back to the Heart Attack Prevention channel on YouTube. We started the channel on July 1st, 2022. Before this day is over, another 1,600 Americans will have a first heart attack. Please watch video number 1 first, the introduction to this series, if you haven't done so yet. Thank you. Coronary artery disease is the number one killer of adult Americans, regardless of gender, race, and ethnicity. Unfortunately, there is not enough public awareness of this fact. Unlike COVID-19, the media made us very aware how many people are dying from COVID-19 on an ongoing daily basis, especially in 2020. At the peak of the COVID-19 pandemic, these photos had become ingrained in our mind. This is not the case with heart attacks. In this second video, we'll try to answer the question that you raised while watching video number 1. Today is July 16, day 16 of our Save Your Heart campaign. Since we started our campaign, about 26,000 had suffered a first heart attack. As part of raising awareness, we will keep an ongoing tally of first heart attack cases starting from day 1 of the campaign. The question we try to find answers for is why the over 600,000 largely preventable first heart attack every year since number 1, we have the readily available $100 accurate non-invasive diagnostic test that doctors need in order to identify those with silent heart disease before they are stricken by a heart attack. Number 2, we have generic cost-effective medication to stop disease progression and stop a heart attack before it happens. And lastly, we have a large volume of scientific data from multiple landmark clinical trials demonstrating that heart attack is definitely preventable. Let us examine this slide. On the left are millions of Americans with silent plaque buildup in their coronary arteries. They don't know that they have silent heart disease, their doctors don't know either, and do not prescribe optimal medical therapy to stop their heart attack from happening. One by one, about 1,600 every day, are suddenly sucked into the first heart attack faucet. On the other side of the wall, different cardiac specialists get busy. That is our current cardiovascular healthcare system, busy mopping the floor. Wait, is the medical system so busy mopping the floor that someone forgot to turn up the faucet? Is that the case? Or is the insurance system telling the medical system, keep mopping the floor? More patients are coming. We'll keep you busy mopping the floor. We are paying interventionalists to put stents, electrophysiologists to put defibrillators, and heart surgeon to perform heart bypass, and everything else you need. It is a lucrative deal. But we are not paying for the $100 coronary calcium scoring test to detect coronary plaques earlier and identify those who are likely to have a first heart attack. And we are not paying preventive cardiologists to stop first heart attack before it happens. Is this why the cardiovascular healthcare system is broken? Is this why our healthcare system is the most expensive in the world, while only ranked number 11 among the richest industrial nations? In 2004, Dr. Michael Wolk, the president of the American College of Cardiology, the largest professional association of board certified cardiologists in the world, in the president page, raised his concern with his title, The Promise of Prevention. So, why aren't all cardiologists preventive? He said many cardiologists have much invested in the interventional treatment of cardiovascular disease. Yet, the evolution to a more preventive approach is inevitable. It will not come painlessly. That future is here. In 2015, another ACC president, Dr. Kim Williams, said, "It's time to turn off the faucet instead of just mopping the floor." Before I proceed further, let's watch video clips from the Widowmaker.
So these are the coronary arteries here.
In the beginning, I think everybody was extremely interested, and everybody would say, well, what's that white stuff that I see there? And I said, well, that's calcium in the coronary arteries.
Calcium, a crucial ingredient in our bones and just what you don't want in your heart.
The calcium is actually part of the healing process. When we develop deposits of cholesterol in the wall of the artery, one of the body's natural defense mechanisms is to put down calcium to try to heal this sort of bubble. So in and of itself, it doesn't cause the disease. What it does, though, is it doesn't occur there unless there is plaque there.
Before the advent of Doug's ray gun, doctors had to use a complicated formula dreamt up at Harvard in the 50s to work out somebody's risk of heart attack. Adding together weight, age, lifestyle, cholesterol, and then guess.
You could have all the risk factors and not have any coronary disease. You could have none of the risk factors and have coronary disease. But if you have a coronary scan and you see calcium, you know you have disease. It's not a risk factor. It is looking at the disease, part of the disease process.
2-5.
There's one last key opponent, the insurance industry. They won't pay for the test. Ironically, the headquarters of giant health insurer Kaiser Permanente are just across the bay from the offices where the very first scanners are installed. In the early 1980s, the Kaiser board come calling.
We met with the Kaiser executives. Of course, most of them came in to be scanned. And some of the Kaiser researchers did some excellent research on coronary calcium screening, published research.
But that didn't mean they'd pay out for their policyholders to have one.
They said, we're not interested because our typical patients are only in the plan for 5 years or less. And this is a long-term cost savings. So the cost savings will go to our competitor. And no need to single out one particular health maintenance organization. All the insurance companies told us basically the same story, that their patients are not long-term holders of that plan. So if they reduce cost over the long term, it means nothing to them. It only goes to their competitor.
We contact the big insurance companies, Kaiser and the rest, to find out why they will still pay for a $50,000 stent, but not unless you're very lucky, a $100 test. But they won't talk. Then one man is brave enough to break the wall of silence. He's been the public face of two of the big five as their media spokesman.
I was a journalist, a newspaper reporter for some time, but then I got into public relations work, and I realized toward the end of my career that something had happened to what I was doing for a living, and it just dawned on me that in many cases I was doing the exact opposite of what I was trying to do as a journalist, which was to try to find truth and as best I could report it to do that. It sounds kind of trite, but I did look in the mirror and say, what happened to you? How did this happen to you? The system is not set up to reward prevention. The system is set up so that doctors are well compensated for treating conditions. So are pharmaceutical companies. We mainly have a disease industry in this country.
We've got a healthcare system that's out of control, spending an incredible amount of our national wealth, not making people better. We've developed a system that's based upon putting out the fires, taking people with chronic diseases and doing all these things to them.
There is just not nearly enough attention paid to trying to help keep people from getting sick, from getting congestive heart failure, from getting the kinds of illnesses that require stents and being put on maintenance drugs and having expensive care for the rest of their lives. They don't want them to die, but they don't necessarily want them to get better.
well, that's where the money is.
Is what you just watched illuminating? It was for me when I watched this documentary for the first time about 8 years ago. The insurance system has significant control over doctors and hospitals since it decides what services to pay for and how much. And indirectly, one can say that the insurance system employs the medical system. Device manufacturers, like those who made stents and pacemakers, would not manufacture their products unless they know that the insurance companies will pay for them. The same is true with drug manufacturers. They will not manufacture drugs unless they know that the insurance companies will pay for them. Doctors and hospitals do the same. They will not provide services that the insurance companies will not reimburse them for. Look at this diagram and trace the sources of healthcare funding. The money comes from employers, federal government, and from you, the policyholders. The insurance system administers the fund, and as a for profit company, foremost in their mind is increasing shareholders' value, not saving lives. This statement you heard in the video explains a lot why there are over 600,000 largely preventable heart attacks every year. We are not interested. They only stay in our plan for 5 years or less. The cost savings only goes to our competitors. Preventing heart attacks means nothing to us. That sounds really cold, right? This business decision of the insurance system not preventing first heart attack because it only benefits competitors causes a lot more heart attacks. It leads to chronic illnesses that could have been prevented or delayed. It keeps healthcare expenditures high, but the people are not healthier. It becomes a vicious cycle perpetuated by profit motive. More chronic illnesses leads to more healthcare expenditures, which leads to higher and higher premiums. Yes, they see a profit in not preventing chronic illnesses. Medicare is a victim of this business decision since the majority of heart attacks occur after age 65. Medicare should have started paying for coronary calcium scoring at least 10 years ago, when the American College of Cardiology and the American Heart Association officially approved and recommended the test. The rest of the insurance usually follows Medicare lead. Medicare has the most to gain when Americans with still silent heart disease receive heart attack prevention medical treatment before age 65. Not preventing heart attack is a double whammy. Why? Because the same medical treatment that prevents heart attack also prevents stroke. Heart attack is the number one killer of adult Americans. Stroke is number three after cancer. So, what is the answer to the question we stated in the beginning of this video? Why the over 600,000 first heart attack every year? First, I think the insurance system is to blame. What do you think? This insurance business thinking that the benefits of first heart attack prevention only goes to their competitors since the policyholders only stay in their plan for 5 years needs to be challenged. This type of thinking is false because the primary benefit goes to you, the policyholders. Potentially saves your life since 1 in 4 drop dead without reaching the hospital. Keeps you healthier, and after 65, Medicare benefits as well. A simple and practical solution is to level the playing field, require the insurance system, Medicare, and all commercial insurance to pay for coronary calcium scoring. Presidents and astronauts get calcium scoring routinely, so you know it's an important and proven test. Saving their life is important. And for $100, isn't your life worth saving too? Don't settle for the crude guess estimation method. It is free and it's just guessing. The method can't answer two basic questions that you want to be answered before you take medications. Number one, do I have coronary plaques or not? Number two, how much plaques do I have? So, know your calcium score and don't settle for less. The medical system carries some of the blame as well for not heeding the advice of two previous presidents of the American College of Cardiology, Dr. Michael Wolf and Dr. Kim Williams. Our healthcare system is broken, but it can't stay broken indefinitely. To fix it presents an overwhelming challenge, but it's not impossible. We need to start somewhere, and that somewhere could be the cardiovascular sector of the healthcare economy. Why? Because it's ripe for innovative disruption. Preventing 1 million first heart attacks in just 5 years is possible. We have everything we need except the right policies. Let us begin to turn off the faucet instead of just mopping the floor. That's innovative disruption. We can't have healthcare reform without health insurance reform. They go hand in hand, since the health insurance decides what to pay for and what not to pay for. The employer sponsored health insurance has a major impact in shaping our healthcare system. What do you think? Do you agree? Let us have a forum discussion at heartattackpreventionchannel.com. The next video is about what happens to communities without access to resources to turn off the faucet and there are no cardiac specialists to mop the floor. Do you live in such a community? Join us next time. I will leave you with another story from the Widowmaker documentary being shared by Autoboss and Danielle, that their story does not become your story.
The new technique can pick out the patients that conventional risk analysis cannot. Thin, fit, and outwardly healthy, and that's a lot of people. In the 4 years after coronary artery scanning is invented, over 500,000 people die of a heart attack with absolutely no warning.
Thank you so much.
California has a governor going places, Pete Wilson. Some talk of him as a potential president. His key aide is Otto Boss, an energetic press liaison in his mid-40s.
He was somebody important. I do remember that. Everybody knew him, and he was the guy behind the guy. So if you wanted to talk to Pete, everybody knew basically you had to go through Otto. So it was pretty cool. So everybody knew me as Otto's kid, and of course I was his firstborn, so everybody treated me like a rock star. So trust me, it was a great life, and everybody's kind of like, oh, that's Otto's kid. Be nice to him. June 2nd was, oh gosh, it was like yesterday. We were actually playing baseball out here on the front street. And then my mother was inside here with our neighbor, and I was called in by our neighbor to, hey, can you please come in and talk to your mom? And I was a 15-year-old kid, so I'm like, yeah, lady, I'll come in when I want to come in. And then she came back out and she was like, no, seriously, you need to come talk to your mother now. She was sitting on the corner of the bed, and she basically just said that my dad had a heart attack and he was at the hospital. I was thinking, okay, he had a heart attack, he'll be fine. Because basically, in my eyes, my dad was like Superman, and nothing ever could really, do anything to him. We went to that hospital, and then when we got there, a doctor pulled my mother aside, and they kept going in and out, in and out, in and out. And then my mom came out, and she was very, very tearful. I knew something was really bad, because I kept going, when are we going to see my dad? And then, long story short, the doctor sat down in front of me about where you are, and just told me that my father had passed, and this is what had happened, and I was a little confused, one, why he was telling me, and not my mother. But they say his arteries were clogged. He looked young. He would never guess that he was 47. He had a rockin' tan, because he was always playing soccer. There was no indication that he was going to have the type of heart failure that he had. I don't know if it's good, but I grew up fairly quickly. So I'm 15 years old, I turned 16, I'm basically an adult. I'm no longer the kid that goes out with his friends and goes and parties and drinks and does, I don't do any of that stuff. And I mean, I had to be a role model for my younger brother and sister and not get myself in trouble and try to be dad for them and, you know, coach Little League, which I did, and take my sister to ballet and my brother to basketball and do all the stuff that a dad would do. A lot of my friends like to hang out, but I really don't, just because my head's not there. I spent more time here making sure she was good and my brother and sister were good. And so that was basically my life for, oh gosh, until my mid-20s.
What about your mom?
She's okay. I mean, you know, she's never gone on another date. I don't think she's even ever talked to anybody about going on another date. I think we've told her to go out on another date, but she won't. And if you bring it up to her now, she still will break out in tears and get very emotional. It definitely messes with you a lot.
The Save Your Heart campaign does not want you to have the same story. Our goal is to help you stop your heart attack before it happens, and knowing your calcium score is the first step. If you are 45 and older and have at least one of the above risk factors, more so the older you are and the more risk factors you have, get a coronary calcium scan and know your score. And don't settle for the crude guess estimation method called 10-year ASCVD risk estimator. It is free, but it's just guessing. Frankly, I think it should be called cardiac palmistry. This method can't answer two basic questions that you want answered before you start to take a long-term medication that you may not even need if your calcium score is 0. The first question is, do I have coronary plaques or not? And the second question is, if I have plaques, how much plaques do I have? So know your calcium score and don't settle for less. Here is the prevention dial, the next step. You can decide how much prevention you want, from the minimum to the maximum possible. While 100% is not possible, you can get as close to it as science will allow with the help of an experienced preventive cardiologist.
We're making a case for less healthcare disparity and better equity. Your health is your most important asset, so guard and protect it well. I hope you learned something of value, and if you did, share it with others and consider subscribing to help the channel grow. Visit us at heartattackpreventionchannel.com. Register at saveyourheartcampaign.com and join our online community. Participate in our forum and take this journey with us. See you again soon.